We need to act it today. We cannot wait for tomorrow.
Nobody can do this alone. Early action saves lives. Empowering our women is also a way forward.
Zero dose children should be a priority.
If we work together across boundaries, we know we could eliminate this cancer.
Getting to zero is very possible.
Hi, and welcome to Getting to Zero, where we talk with top global public health leaders about how to bring cases of preventable diseases down to zero via immunizations and other public health measures. To stay connected to these conversations, be sure to like and subscribe below. I am your host, Nicole Basta. I am Canada Research Chair in Infectious Disease Prevention, Associate Professor of Epidemiology at McGill University, and the 2024 Sabin Vaccine Institute Rising Star Awardee. It is both a pleasure and an honor to be joined today by Dr. Natasha Crowcroft. She is Senior Technical Advisor for Measles and Rubella at the World Health Organization. She has over 30 years of experience working to improve public health for communities locally, nationally, and now globally. Hi, just a quick update. Since we recorded this interview, Professor Crowcroft has taken a new position. She is now the Vice President of Infectious Diseases and Vaccination Programs at the Public Health Agency of Canada. Okay, let's jump right in. Measles vaccine has really been at the top of the news recently in many parts of the world, and dozens of countries report large measles outbreaks each year. But the measles vaccine has really been one of the most successful vaccines we've ever had. It's estimated that it's saved 60 million lives just since 2000. What is causing these ongoing outbreaks, and why aren't measles vaccines reaching everyone who needs them?
Thanks for your question, Nicole. I think you've almost answered it yourself, because you've said, why is the vaccine not reaching everyone? And that's the problem. And you can't stop these outbreaks happening unless you reach everybody with vaccines. So how do we do that? Well, it's a challenge everywhere. And the reason it's a challenge everywhere is because measles is the most infectious virus we know of. It spreads like wildfire. If there's a single child who's susceptible, they'll catch measles from somebody else if they just walk into the room with them. So we're starting with a biological challenge of trying to control this very infectious virus. So even with the best vaccine in the world, it only works if it reaches children, and you can face real challenges reaching every child. The reasons you don't reach every child do vary from country to country. So we talk a lot about vaccine hesitancy in high-income countries. But when you move to middle-income countries, low-income countries, and those are like World Bank classifications of where countries sit on their economic scale, it's usually much more a question of how the health system is organized, and how well organized clinics are, where they are, whether children can get to them, which is, I think it's almost like a military operation running a really good immunization program. Every piece of the chain has to work perfectly to make sure that the country has the right vaccines in their program, can get them to everywhere they need to be, to a cold chain that works, has the clinics, has the highly trained health providers there to reach the kids and can find the children. And that's not obvious. If you imagine a country where they haven't had a census for 15 or 20 years, where they have really remote areas that take days to reach, whether, no roads or the roads turn into rivers in the rainy season. It's a huge challenge to reach every child. But there are countries that do it despite rivers roads that turn into rivers, despite urban settings where there's huge inequality, they manage to reach children. So we do know how to do it. But that doesn't make it easy. The countries can do it. A lot of the work we do to help those countries that are challenged to move to a place where they do reach every child with vaccines, especially the measles vaccine.
You've really highlighted a number of really important challenges. Can you talk a little bit about, in your work with WHO, what approaches are you taking to help countries and communities prioritize measles vaccination and support the implementation of those vaccination programs? And what efforts have been most effective at increasing access?
Yeah, so we we don't work alone. The World Health Organization is a membership organization, so we work with the countries, primarily countries at where everything starts. That's where it happens, and we work with partners within the country and within the regions that countries and where countries are located, and then with partners outside those regions. So in terms of the most vulnerable countries would be, in general, the ones that are eligible for support. So we do a lot of work with Gavi to reach children in those countries. And I would say one of the biggest pieces of work we've done in recent years has been to really push the importance of having regular campaigns of very high quality in countries where the routine system is just not strong enough. So, in countries where they're reaching 50 or 60 or 70% routine immunization coverage, the only way to really make sure that children are protected is to catch them up through regular campaigns. And those campaigns have to be on time and they have to reach all the kids that were missed. So that is a job of work in itself, just finding out where those children are. It involves a lot of support and planning, a lot of communication with communities right at the grassroots level, so that families know that there's, it's like the circus is coming to town, it's the immunization is coming to town, get your kids immunized. And in those sorts of settings, generally, if everything's done as it should be, then high coverage is usually reached, because in the settings we're talking about, people generally know about measles and they know it's bad and they get their kids vaccinated. So it's more a question of really making sure that everything we know already is put in place in a very systematic way, and that the local health staff have the support they need to make sure they can get out there on the day. That families know they need to come, bring their kids and get them vaccinated. So it's sort of work that's a far cry from what you might expect if you're sitting in, sitting in Canada or US, where you have a pediatrician in their office or a family doctor in their office, and they have a whole system for inviting kids in or families in to get immunized. Here we're talking about much more house-to-house visits in a village where it's much more, walking around and trying to find the children and make sure they come to the site where the immunization is happening, rather than relying on more electronic means of knowing who the kids are. So that's one thing we've been doing. Just moving on from that, makes me think actually that at the same time that our countries are putting in more electronic type systems, and so that's the direction of travel we want to go in, where countries like Pakistan is putting in a system so they can identify that through their national electronic immunization record, they can identify kids where they are and follow them up. So that's the future for countries everywhere, and that's what we'd like to see everywhere. But in many countries, are a long way off having that kind of system in place.
That's a great example of trying to improve vaccination campaigns and be more efficient for the future. Thank you. What would you say are some of the challenges in those countries and those locations where vaccination rates for measles are actually declining because of vaccine hesitancy and concern about vaccination for measles? What can be done in those areas to improve vaccine uptake and acceptance right now?
Yeah, so this is a very common question. I think the answers are really vary on the local context, and the general answers you can give is you need trusted experts that understand the local context. And they don't necessarily have to be an expert, as in, the world expert on X, Y, or Z, but they need to be someone with credibility and authority in the community who understands where the hesitancy is coming from. And it varies a lot. I mean, it's really interesting. What makes people hesitant depends a lot on the local context, the culture, the history of the program. If things have gone wrong in the past with other vaccines, then they may be concerned about measles vaccine as a result. We saw that a lot in outbreaks of measles following, for example, the dengue vaccine was introduced. at one stage, which caused issues. And then people stopped immunizing for measles. And then there was a big measles outbreak. And then that actually, in some ways, solved the problem. It's not the way we like to solve the problem. But as soon as you have an outbreak, that's often a fix for vaccine hesitancy, where people step forward and get their kids protected because they see what would happen if we don't. So it's very, very different depending on the context. It depends on the culture of the community that's affected, and it depends on the issue that they're worried about. Whether they've heard about MMR and autism, or they discredited scare, or whether they have a general issue with vaccines. It's really has to be adapted. We're kind of looking for single solutions, and they have to be developed in the local context with the communities that are affected, kind of respecting the views of those communities, and adapting the messages to them. Most parents really want the same thing for their kids. They want them to be safe and healthy and grow up to be safe, to be healthy adults. They don't, we've got that shared goal, and sometimes it's about developing the relationships with people who may say no today, but they may say yes tomorrow. We also hear stories about kids who grow up and who've never been vaccinated, and when they become of age to be able to make their own decisions, they make different decisions to their parents. And again, that's often facilitated by having good relationships with their own health staff, because that's the trusted place they'll go. So if they've had a family doctor who didn't, who was positive and supported the family through whatever they were thinking, even if they didn't manage to sway the parents, if there's a good relationship there, that's something to build on for the future. And so that's something we really need to be in listening mode and understanding what the community is going through and why they're feeling the way they are, and try and address those issues where we can, and meet them where they are.
I think your point that context matters and that relationships and trust matters in the context of measles vaccination and measles acceptance is a really important one. We're seeing so many different challenges in different communities around the world, and tailoring those solutions to help ensure that measles outbreaks are as rare as possible is going to be really important in the future. I want to expand our conversation a little bit to focus on another important disease that you've been working on, and that is rubella. We hear a lot less about rubella than we hear about measles. So can we talk for a moment about why we should be thinking about rubella as well? Why is rubella such a devastating disease, and what is the current situation with rubella vaccination?
It's a periodic epidemic disease, sort of not front of mind. Unlike measles, it doesn't come back every couple of years if you don't have a vaccine. It tends to be much more, you have periods of time where there's a lot of rubella around, and a lot of people get infected, and then it goes away again for a while and everyone sort of forgets about it. And that's the history of rubella. Why it's a problem is because if women are infected in early pregnancy, it can be absolutely devastating. Up to 90% of babies are affected by if their mother's infected in early pregnancy, and the impact the baby may be lost, they may die during the pregnancy as a result, and the baby's people with problems with almost every system in their body, including severe developmental delays as a result. We often hear about the eye problems. They get congenital cataracts. Everything can be affected, but it's really, really the children are born with devastating problems, and it's something that can be prevented by a single shot. Actually, the single dose of the vaccine is so effective, if you prevent the spread of that virus in the community. So, the reason I was talking about measles and rubella together, because they're kind of in the same situation now. You don't give rubella vaccine on its own. So every country in the world except for, there's only a very small handful of countries that don't have rubella vaccine. Every country that has achieved rubella elimination, and every region, there's one so far, the Americas, that has achieved rubella elimination, has sustained it. It stays, because rubella is not quite as infectious as measles. So the vaccine is more effective, and it has it's more robust. The elimination is more robust. And so gradually, countries are achieving elimination. We're getting closer and closer to the point where all countries could potentially eliminate rubella. And last year, we got a big decision made by the World Health Organization's Strategic Advisory Group of Experts to lift the remaining barrier to introducing rubella vaccine in every country in the world. So these last few countries that haven't introduced, which couldn't previously, now the door is open. So now we have to figure out how to get the vaccine in. A few of them are in the process of doing it. A few big countries, Nigeria and the Democratic Republic of the Congo, are going to be introducing rubella vaccine later this year, which is brilliant because those are two of the biggest countries in the African region. There's 13 countries that haven't yet got there for plans, but now they can plan to introduce rubella vaccine. And once they've done that, we really can make on eliminating rubella in the African continent, which is going to be a huge step forward. So I think you said earlier that measles vaccine is available in every country in the world. The question is, how do we get it to every child? We will soon have rubella vaccine in every country in the world. We'd hope that we achieve that by 2030. That's the goal. And once we've done that, then we can really start making strides towards eventually eradicating rubella, which would be an astonishing next step. It's really the low-hanging fruit in immunization that we could feasibly eradicate rubella in our lifetimes, which we can't say about many things.
Yeah, this is really major news for rubella vaccination and introduction. Once rubella vaccine is introduced in all countries that are remaining, what would it take for rubella elimination to be one of the next great global health success stories? What are the next steps in making sure that rubella elimination can be achieved everywhere?
I think the history of elimination success is really requiring very strong political will and solidarity between countries. If you look back at the story of smallpox, if you look at polio, and you look at what we've achieved so far with measles and with rubella so far, I think my first experience was in the Americas, where countries were really concerned about making sure they didn't let each other down, and there was a very clear regional plan driven by a very charismatic person and by the support of all the countries in the region. You have to have countries signed up to it. So we know how to do it at regional level, and I think the same is true at global level. You need to have that kind of coalition of countries everywhere with the support of global leadership and global agents to make things move in that direction. The thing I sometimes say about rubella is we may actually eliminate it globally almost without setting a goal, because it seems so robust that if we don't, better hurry up and set a goal in the near future. Otherwise, and I say near future, I don't mean, next week or even next year, but we are heading in that direction anyway. With measles, it's much more challenging because you can go backwards as well as forwards much more quickly. But I think, it's that idea of everybody coalescing around a shared goal and having country buy-in to that this is something they want. And without that, it doesn't matter how many technical people say we can do this and this is a direction we need to go in. You won't get anywhere. We need ministers of health saying we want this. We need them coming to the World Health Assembly saying this is what we want to do, and then it can happen.
I think that's a great note to end on, that local, national, regional, and global collaboration and partnerships are more important now than ever. So thank you for sharing that point. And thank you so much, Natasha, for sharing your expertise and insight on both measles and rubella. It's really been wonderful speaking with you today.
Thank you very much, Nicole, for having me on the podcast. I really appreciate it. For shining a light on measles and rubella, which really need our attention right now, more than ever.
Absolutely. Thank you. And thank you to all of you who have tuned in from near and far for this episode of Getting to Zero. See you next time.